What are some other misnomers in eye care that you can think of, so we can provide better understanding for other clinicians and also for patients?
This might be controversial to say, but I even think that ocular surface disease is a bit of a misnomer in of
Hmm.
itself too, though, because a lot of our patients' symptoms of discomfort don't originate from the ocular surface. A lot of our patients' symptoms of discomfort are actually a peripheral manifestation of a neuropathic pain syndrome. And we
Hmm.
know this because there's, the top predictors of whether or not a patient has dry eye symptoms are all non-ocular. Like the
Oh,
top
wow.
predictors of whether or not a patient's going to have dry eye symptoms are things like the presence of anxiety and depression and migraines and poor sleep and fibromyalgia and all of these things that are really being governed systemically in the
Hmm.
nervous system. And so that's why we see a lot of our dry eye patients, you put proparacaine in their eyes and you say, do your eyes feel better now? And they say, no, like my eyes are still bothering me. And so we know that a lot of these patients have neuropathic features to their dry eye. And a lot of these dry eye symptoms aren't really necessarily coming from the ocular surface, but are further upstream along the trigeminal nerve. And,
Hmm.
the trigeminal nerves goes into C1 and C2 of the spine. So that's where we
Hmm.
get the term cervicogenic eye pain. Then a lot
Hmm.
of these patients really have problems with the somatosensory cortex of the brain and the pain processing centers of the brain. So they're experiencing dry eye symptoms that are actually non-ocular in nature. So, I think that, dry eye is a misnomer. I think ocular surface disease is accurate a lot of the times, but
Hmm.
in of itself can sometimes be a misnomer.